My name is Jackie Baden, and I'm one of the nurse practitioners at Healthfirst Network, serving 9 counties in central Wisconsin and specifically serving Sauk County. And today I'm just going to present some information regarding HPV or human papillomavirus. We talk a lot about HPV, but what actually is it? So, HPV is basically the short name for a family of viruses called human papillomavirus. At the present time, we've identified over 150 different types of this virus. There are some types that cause common warts that you can see on your hands or your feet. Most people have seen those common warts. A lot of people have heard of plantar's warts. But there are also some types of that virus that can be more concerning and actually can cause certain types of cancer. HPV is also the most common sexually transmitted infection in the United States. In fact, so common that almost all sexually active people in the United States will get HPV at some point in their lifetime. Sometimes of the virus that affect the genital area are low risk for cancer. Other types are high risk for cancer. So as you can see down here, we know that 85% of people will get it in their lifetime. This is probably higher than that, closer to 90 to 95%. Right now, 4.42 million Americans have HPV that is active. And we know that 13 million teens and adults will get HPV every year. So super common. So how do you get HPV? HPV is a virus that is transmitted by skin-to-skin contact through vaginal, rectal, and oral sex with someone who has the virus. We know that vaginal and rectal sex are the most common ways to get the high-risk types of that virus. And most people with HPV aren't aware that they even have any symptoms. So it's spread by skin to skin contact through sexual transmission. Um, Genital warts are mostly just the skin to skin touching during sex. But the high risk types or the types that are associated with cancer are transmitted sexually. Most people don't get symptoms of the HPV virus, especially the high-risk types, generally don't cause any symptoms that people can recognize that they have an infection. So most people transmit the virus without even realizing that they are infected. Can get HPV. Anyone who's sexually active can get HPV. And the more partners that you have, the more likely you are to be exposed to the virus. And the more partners you have, it makes you more at risk for getting the type of the virus or that high risk types that can lead to cancer. It can take years for the HPV virus to cause changes or symptoms, so you may not know when or if you've been exposed. You might not know that you have the virus now or if you've ever had the virus in the past. Most healthy people will also eliminate this virus over the course of 2 years without any signs or symptoms developing. When HPV doesn't go away, you can develop symptoms. Sometimes this is with the low risk HPV that doesn't cause cancer, but can cause the genital warts that you can see. You may see small bumps or growths in the genital area. They can be small, they can get very large, they can be raised or flat, they might look like cauliflower. Genital warts can be treated with creams that you apply or freezing the warts or burning them off with an acid solution. There's a cream called imiquimod that also helps boost your immune system, helping you get rid of the virus from your system. Most genital warts will resolve over the course of 2 years without any treatment. but most people don't like to have them there. And it makes you at higher risk of transmitting that low risk HPV or genital warts to a partner when those lesions are there. High risk HPV can be detected through changes on a pap smear or screening for cervical cancer. We don't start cervical cancer screening until age 21 because we know that younger people, if they're exposed to HPV, tend to clear that virus and it causes a lot of unnecessary procedures and follow up if you're doing cervical cancer screening early. There may only be certain instances where somebody would have a pap smear before age 21. Otherwise, we start that screening at 21. We don't generally screen for HPV at 21 because, again, the virus often will go away on its own without causing any problems. Um, there are no other screening tests, unfortunately, for HPV. So we can't really screen for HPV in the mouth area or in the anal area, and there are no screening tests available for men for HPV. So sometimes people find out that they've had the infection only after they've developed more serious problems, such as cancer. When women are 30, we start routine screening for HPV because we're looking for infection that someone may have gotten when they were in their younger teens or in their 20s, and that has been persistent, that did not go away in over the course of a couple of years. We know that that type of an HPV infection, when that's persistent, is more likely to cause cervical cancer. So why should you be concerned about HPV? Because anyone who's sexually active can become infected with HPV. It is the cause of almost all cervical cancer worldwide, which is the fourth most common cancer worldwide. In the United States, there are about 11,500 new cases of cervical cancer each year. And about 4,000 women die each year from cervical cancer, even when they've had treatment and screening. So we know it's still a significant cancer causing problem in the United States. It's also associated with cancer of the vulva, vagina, the penis, the anus, and the back of the throat that can include the base of the tongue and tonsils. It can take years for these cancers to develop, and there is no way to know who will develop cancer or who will clear the HPV virus or who will have other health problems from HPV. So, how can you protect yourself from getting HPV? Abstaining from sex is the only sure way to prevent pregnancy or infection with any type of STI, such as HPV. Abstinence is important, but it may not be realistic over a lifetime. So, we also recommend that if you're sexually active, limit your number of sexual partners and be in a mutually monogamous relationship where you're only having sex with a partner who only has sex with you. We know also that condoms can provide some protection from HPV infection, especially the high risk types that are more likely to infect the rectal area or the cervix, causing cervical cancer. So condoms can be helpful, but they won't completely eliminate the risk. And anytime you have a new partner, you have a new risk of getting the HPV virus. We do recommend condoms with every act of vaginal, anal, or oral sex because it can lower that, like I said, that chance of getting an HPV infection, but it isn't going to be protective against genital warts because of the skin to skin contact in areas that are not necessarily covered well by a condom. For women that are 21 to 65 years old, we recommend getting your screening for cervical cancer or a pap smear. Um, as recommended. So for women that are 21 to 30, we recommend a cervical cancer screening or pap smear every 3 years as long as they're negative. At age 30, we start screening with pap smears, but also with an HPV test, again, trying to detect that persistent risk type of HPV that could lead to cervical cancers. With these pap smears, we often detect precancerous changes that can be monitored and treated if needed before they ever have a chance to become cervical cancer. We know that in the United States, we still have a lot of missed opportunities for cervical cancer screening. So even though pap smears are recommended and they're available, we know that still a lot of women are not getting in and getting the routine cervical cancer screening. So we know that 7 out of 10, which is a significant number of women, are not getting screened. And you can see on the bottom part of the slide here where it shows how HPV infection can lead to cervical cancer, and it can take decades for that to happen. So we know that often the normal cells in an 11 to 12-year-old before someone becomes sexually active, um, that's opportune time for vaccination, that most HPV infections occur usually in late teens, early 20s. We're checking for persistent HPV infection and cervical changes um, at screening intervals of every 3 years from 21 to 30, and then the HPV screening added at 30 and older so that we may pick up those precancers that can still go back to normal, but if not detected, if not treated, sometimes those lead to cervical cancer. The most common age for cervical cancer is between the ages of 35 and 50. And that's often when women, for whatever reason, are not coming in routinely for their primary health care and getting their pap smears. Other things that can help is getting vaccinated. We know that Gardasil is the only vaccine developed to prevent cancer of any type. It provides protection from that low risk types of HPV and 7 high risk types that are most likely to cause cancer, especially in the United States. We know that it's safe and effective, and we know that getting the vaccine prior to becoming sexually active provides the best protection, but it still is recommended for adults up to age 45 because it can still get a benefit from the vaccine. As healthcare providers, and especially women's health, where we're doing a lot of cervical cancer screening and follow up for abnormal cervical cancer or abnormal pap smear results, we've seen a significant reduction in abnormal pap smears in women who've received the vaccine, especially when they got it as a teen prior to becoming sexually active. So we know that it works. Other helpful measures, make sure these are all things that can help your immune system stay healthy. And we know that healthy immune system is the one of the best protections against uh, getting HPV or having it stick around for a long period of time with that ability to cause cervical cancer. So, eating well, make sure you got plenty of fruits and vegetables in your diet, getting adequate sleep, at least 7 to 8 hours a night. And if you're a teen or young adult, you may need closer to 10 to 12 hours of sleep a night. We know that exercise is important, so moving your body daily and doing something regular for exercise most days of the week, something as simple as walking can be helpful. Reduce your stress or trying to minimize the stress in your life. Smoking is one of the biggest cofactors in allowing that HPV virus to make changes and preventing you from eliminating the virus. So do not smoke or vape, or if you do, stop. And there are plenty of resources to help with smoking or vaping cessation. A couple of supplements may be helpful. So we know that women of reproductive age should be getting 800 to 1,000 micrograms of folic acid daily in their diet, as we know that most women are deficient in that. And we know that vitamin C helps boost the immune system. And so 500 milligrams daily is recommended, especially if you know you've been exposed or have had an abnormal pap smear or have an HPV infection. Those things can be helpful. It's important. Condoms are an important measure to not only prevent pregnancy, because they can be very effective if used consistently and correctly. We also know that they protect against many STIs, such as syphilis, HIV, chlamydia, gonorrhea, trichomonas, but they're important that they're used correctly and consistently. We know that when you use condoms along with another method of birth control, it makes that method of birth control also more effective. And condoms come, external male condoms come as latex or non-latex. We know that there is an increasing concern for latex allergies or irritations, so there is non-latex versions of condoms also. It needs to be placed over an erect penis or shared toy before there's vaginal penetration. Um, and you need to use a new condom each time with every act of intercourse. It's important that condoms are stored correctly, so we don't recommend keeping them in a car glove compartment where it gets hot or where it gets extreme cold, because that can break the latex down. It's important that if you're using lubricant along with a condom, that you're using a water-based lubricant. Any petroleum-based products, such as Vaseline, um, can break a condom down within 30 seconds. There's other barrier methods available too, other than condoms, internal condoms or female condoms are a non-latex covering condom with with dual rings. So a smaller ring that's placed into the vagina. It can also be used for anal sex. So it can be placed in the anus. And then the pouch with the condom um, fits along the vaginal or the anal walls, and then the external ring or the larger ring is on the outside. Again, this condom needs to be used a new one each time. Female condoms are not quite as effective in preventing pregnancy as a male condom because they're a little more tricky to use. It takes practice to get good at using a female or internal condom, but it does provide a lot of the same protection from STIs. It provides a little bit more coverage over at the vaginal opening to help prevent genital warts and other STIs like herpes that are also skin to skin transmission. Another external barrier method that can be used are dental dams. And basically, this is a piece of latex that's used mainly for oral sex. So it covers the vaginal opening, it can cover the testicle area, it can cover the anus. You can use an internal or external condoms and basically cut it open so that it lays flat to cover um, the genital area. And again, this needs to be used, a new one used each time. It can provide protection against STIs, and it can provide that barrier over the vaginal area that can help prevent herpes or genital warts. And if there's any questions, if there's any comments, um, please let us know. Otherwise, thank you for listening to my portion of the presentation, and I'll pass it on to the next presenter.
Hi, I'm Barb Walsh, and I am a public health nurse at the Sauk County Health Department. And I'd like to talk a little bit more about the human papillomavirus HPV vaccine. As mentioned earlier, there are many cancers. Approximately 34,000 cancers are caused by HPV in the United States each year. So the HPV vaccination has resulted in a lot of declines in the vaccine type of HPV infections and anal genital warts and cervical precancers. In addition, because people have received this vaccine, there we also finding some protection in those who haven't received the vaccine. So those who are vaccinated are not contracting the HPV virus and thus not transmitting it to those who are unvaccinated. So who should get the vaccine? So HPV vaccination is recommended at ages 11 to 12. That's when the teenagers are typically coming in for a couple other vaccines, and we offer it at that time. But the HPV vaccine can be given as early as 9 years of age. So it's recommended that all preteens need to get this HPV vaccination so they're protected from the infection that can cause cancer later in life. CDC also recommends vaccination for everyone through age 26 years if not adequately vaccinated when younger. There are some adults aged 27 to 45 years of age who may decide to get the HPV vaccine based on discussions with their clinician if they did not get adequately vaccinated when they were younger. So is the HPV vaccine safe? Yes, the HPV vaccination has been studied very carefully and continues to be monitored by the Centers for Disease Control and the Food and Drug Administration. There have been no serious safety concerns linked to the HPV vaccination. These studies, which continue to occur, show that HPV vaccines are safe. So what are the side effects to the HPV vaccine? So the most common side effects reported after HPV vaccinations are mild, similar to other vaccines. They include pain and redness in the area of the arm where the shot was given, fever, dizziness, and nausea. Why does my child need this vaccine now? So the HPV vaccine offers the best protection to girls and boys who complete the series and have time to develop the immune response before they begin sexual activity with another person. In essence, before they come in contact with the virus. This is not to say that your preteen is ready to have sex. In fact, it's just the opposite. It's important to get your child protected before you or your child have to think about this issue. The immune response to this vaccine is better in preteens, and this could mean even better protection for your child. And that is the end of my presentation. Just one other thing that I wanted to mention, most health insurance plans cover the HPV vaccine. However, if your child is not insured or your insurance doesn't cover the HPV vaccine, the Sauk County Health Department will be able to provide that vaccine at no charge. Thank you.